Dr. Yates in Chicago, Illinois with one of my good friends, Eche here. And he's coming back. How long has it been since your hair transplant?
Oh, it was September last year.
September last year, so it hasn't even been a full year, maybe 9 months, 8 months, something like that. And you can see now, he wears his hair short. I want you to turn just a little bit this way. And you can see that, we punched out his grafts in the back with a 0.8 millimeter punch. Do you know if you did PRP at the time of the procedure?
Yeah, I did PRP.
He did PRP, and turn around at you. And I want to say I've been using a lot of PRP with my procedures, and I've found that it acts kind of like a fertilizer when we plant the grafts. We seem to get earlier growth and better growth, better retention of the grafts for a lot of reasons, which we'll discuss on an in-depth video on PRP and hair growth. But I just want to, he hasn't seen his picture, before he had the procedure, and he's upper 22 to the 6, okay? Yeah. He's 26, he's got a fancy job, and he's looking good. And I'm going to show him his picture from a year ago, and I want to see if this is you. Is that you?
Yeah, that's me, but
it's not you.
I look 40 in this picture.
Yeah, let's say.
Yeah.
Look at that.
It's a big improvement.
He looks like, I don't know if all the old guys know who Walt Frazier is, who plays basketball for the Knicks, who's about 55 now. He looks like Walt Frazier. Walt, if Walt's watching, you're not bad looking, but you're a lot older than Eche here, So look at his hair now. So it's about 1,400 grafts. We focused on the front. And usually when we do, African American hair, what we call Afrocentric hair, we just focus on one region. The most I'm going to do in any one procedure is going to be 1,500 grafts because I find that's the sweet spot. You just don't want to push it 2,000, 2,500. That's just me. So you can do as many as you want, but I find doing up to 1,500 grafts with PRP seems to be the best. So we focused in this region here, with about 1,400 grafts. You see he's got nice combable hair. He's smart because the best hair transplant equalizes densities. He's got his sides cut short to show off the top. A lot of people come in and their sides are out like bozo. You just can't do that. You have to make up for the density that you don't have up top by thinning out the sides to get the best from your hair transplant. I used to have somebody who was very wise at hair transplants would tell me that patients can make their hair look as good or as bad as they want to when they come in and see you, and that is so true.
That's true.
So a lot of times when people are on the internet and saying, "Oh my God, this doctor did this and that," and they show their hair with one strand up, and then they come in the office and you can comb it and it looks great. Again, you can make your hair look as good or as bad as you want to. I give you an A+. You have made your hair look fantastic. I mean, you look red carpet ready. You look good. You make me look good, and So today we're doing more. We're going to do some back in this mid scalp here, and of course we're going to put some more up in here. But right now, I think overall, we're winning, as we say. So anything you want to say? I mean, obviously you do it again because you're here, right?
Yeah, I'll do it again.
Yeah, for all the guys who are chicken and say, "Oh, what would you say to them?"
I trust him.
Yeah.
The result shows for yourself, and I'll come back. I'm doing it right now, and I really appreciate what he did for me.
Oh, well, you didn't have to say, "Oh, that's very nice." That's and I didn't pay him to say that either.
No.
Okay.
Said it with my own will.
Yeah, thank you. So, we're signing off, but again, FUE. A lot of people have said, "Well, it doesn't work well for this type of hair. It doesn't work well for this type of hair." It's so much out there on the internet, so we just want to let you know that FUE done correctly works well for every type of hair. Okay, signing off in Chicago, it's Dr. Yates.